Hi, it's Ashley Latter here again with the latest Lunch and Learn. And the topic I'd like to discuss with you today is hygiene appointments and how to maintain and keep a full hygiene book. I don't think there is ever a month that goes by when I'm not speaking to a practice owner or a practice manager where one of the challenges they have is the cancellation of hygiene appointments and how do we maintain or grow our hygiene business. Well, I could probably do a 16-hour video on this, but what I want to do in this video is just give you very few quick tips and nuggets and see if it help you grow and maintain a full hygiene book. So the question is this: why do people cancel their hygiene appointment? Why do people cancel? Well, when I speak to practices, often we hear things such as, well, I've got a very important meeting at work, or I've got the flu, I'm not too well, I can't get out of bed, or maybe just something personal that's just popped up. And normally we find that these all often happen within 24 hours of the actual appointment itself. And then what happens is the reception is trying to fill those appointments up and then spend dead time really trying to fulfill or try to maintain the hygiene book. In my opinion, one of the major reasons why people don't maintain their hygiene appointments is that they don't see the full benefits of attending, and that's my opinion. So why do you think we don't do this? Well, one of the reasons is I don't think the dentist or the hygienist or the whole team explain the full benefits of why they need to maintain and go to the hygiene. And often when I speak or coach my delegates on what they tell their patients about the hygienist, they say that they clean their teeth for them. Well, if you think about it, look at the language there, clean the teeth. Well, it's actually something that I do every single day. And it's something that your patients do every day as well. So what we need to do really is have a stronger benefit on why we go to the hygienist and why the patient needs to maintain and go to the hygienist. So one of the things you can do is obviously get your hygienist together, get the whole team together and discuss what the hygienist does and what the major benefits are of attending. Now, obviously, once you've done that, you will look at, well, at the end of the day, a hygienist works and maintains your gums, keeps them stronger. And that's the language that you need to start using with the patient. You need to focus on that and the focus on the advantages by doing this and maintaining this, that the patient keeps their teeth a lot longer. And you also need to say that the hygienists, they have a special interest in this area and are more specialists. They can give them more time than the dentist can normally have. So that's another major advantage of spending time with the hygienist. Now, you've got to really, everyone in the whole team needs to be able to communicate this to the patient, and particularly the dentist when they're in their appointments. So the patient sees the real benefits of why they should go and what difference that they can make and what the difference between the hygienist does and what the dentist does. And that would probably take, I don't know, 2 or 3, 4 minute explanation, but it really is well worth doing. Now, once you've done that, obviously the patient can see the major benefits and hopefully they'll be more enthusiastic about going to the hygienist. But again, it doesn't stop there. And in my opinion, the hygienist then needs to resell again what the hygienist is going to do, explain to the patient what she's done in the appointment, explain to the patient what they need to do to keep their gums healthy in between the next appointment. And then, of course, they need to resell the next appointment, which again is either 3 months or 6 months down the line, whatever the policy is in your practice or whatever the needs are of the patient. And ideally, what I strongly suggest is you make the appointment there and then, and if you can, take the deposit or payment for that appointment. And that way, the patient, A, knows the advantage of coming, B, is committed, the appointment's already made, and of course, if they've made a financial commitment to that, they're more likely to keep to the appointment. So I can't really give it too much justification in a quick 4 or 5 minute video. I think it's a team effort. I think you need to get the whole team together with the hygienist, really look at this in depth, talk about the advantages, talk about and maybe the hygienist giving a presentation as well on what he or she does so the whole team are fully aware. But also what we need to do is spend time communicating to the patient, because at the end of the day, they didn't go to dental school, they didn't go to hygienist lessons, and really speak to them as if they are a novice and they don't know anything about it. And that communication needs to be maintained at every appointment, ongoing, so the patient is committed to attending to the hygienist all the time. And if you do this and you book appointments in advance and take deposits, I think you should hopefully see an improvement in people attending your hygienist, and at the end of the day, a reduction in people cancelling, which ultimately will make more profit for the practice, but also save the receptionist time in having to run around trying to fill people and getting hygienist appointments at the very last minute. I hope this has been useful. Get your team together, make this a commitment, do a 1 hour lunch and learn on this, put these new policies into place, and I think you'll see an improvement in your figures.